Hey everyone, my name is Shay and today I'm going to be talking to you about the DEXIS CariVu system and how it's used to detect caries. Let's get started.
Okay, so what is the CariVu system? This is a caries detection device that utilizes transillumination to help detect carious lesions. It detects recurrent decay as well as caries on the occlusal and interproximal surfaces. It can also be used to detect caries earlier than clinical detection or dental radiographs. How it is used in dentistry. This device is placed on the tooth surface to be scanned and hugs the tooth. The tooth is then bathed in infrared light. This device utilizes transillumination technology to make the tooth appear more opaque so caries appear radiolucent. Clear images are displayed on the monitor as well as video imaging capabilities. Decay is seen as a dark shadow inside the tooth. So what are the pros of the CariVu? CariVu is used as a great patient education tool. It provides live images and video of carious lesions as well as cracks in the enamel. Improved caries detection. Enamel appears transparent when penetrated by infrared light, making carious lesions appear darker. It utilizes non-ionizing radiation. This makes the detection tool safe for pregnant patients, children, and those opposed to X-radiation. It also shows caries in beginning stages. This gives the doctor the opportunity to arrest the carious lesion before it causes more tooth destruction. The cons of the CariVu. Cost. This product can be quite expensive, especially when needing more than one per office. It also does not completely replace traditional dental radiographs. Supplemental radiographs, such as a panoramic radiograph, occlusal radiograph, supplemental bite wings if the interproximal is not captured adequately enough, and it should not be used to replace a full mouth series. It also utilizes DEXIS software, and if the office does not have this software available, it would also be another added expense. How it compares to industry standard. The current industry standard is to take dental radiographs using either digital sensors, some still using phosphor plates, or nomad imaging. CariVu provides a supplemental image or video of carious lesions and can often detect those lesions sooner than a dental radiograph can. This technology is also very user-friendly, and it can work with existing DEXIS computer software and generates images or videos on the computer screen to be used for monitoring or patient education. It also improves patient comfort. The patient does not need to bite down on a sensor and wait for the image to be taken. Images can be taken and assessed in real time. It also limits the amount of time the patient needs to be compliant. Similar products on the market. The first is the Diagnodent. We're quite familiar with this piece of technology and use it while we're in clinic. It's a caries detection tool that uses fluorescence to help detect decay. Much like the CariVu system, this system is used to help monitor the progression of decay. This technology costs approximately $2,698 per unit. Some limitations of the device include it requires calibration on a virgin tooth that does not have calculus or restoration present. It's numbered from 0 to 30, which requires the clinician to understand the numbering system and what more advanced decay will be represented as. It's not as reliable in interproximal areas and can only be used on the occlusal or flat surfaces of teeth. Also, it does not detect recurrent decay. You can also not use this device with fluoride-containing dentrifice or prophy paste. The Canary system. This is a laser-based system that can detect caries and cracks in the enamel. It uses luminescence to detect caries as far as 5 millimeters deep in the tooth surface. It has a built-in intraoral camera and number system for caries. It has a numbering and color system, numbering from 0 to 100 with corresponding color. It does not use ionizing radiation, and it can be used on all tooth surfaces. While I was unable to find a definitive price for this system, some places advertise the unit costs upwards of $16,000, which is way more expensive than the CariVu. So how much does the CariVu cost? According to Henry Schein, it costs about $5,295 per unit. While this does seem a little expensive, compared to the Canary system, this is quite the bargain. Would I recommend this system? After doing some research, I feel this is an innovative tool that every office should have in its repertoire because the CariVu system provides superior caries detection that cannot be seen with the naked eye and with modern radiographs. This also enhances patient compliance, especially for those who are against dental radiographs and radiation exposure. This product will also provide visual evidence of carious lesions for monitoring and education. I do hope I have the opportunity to utilize this tool while in private practice. The benefits. The patient benefits by receiving the highest quality of caries detection available. Immunocompromised patients, such as children, pregnant individuals, or those undergoing chemotherapy, are exposed to less radiation than dental radiographs. The clinician also benefits because by reducing the amount of time needed for a full mouth series if not indicated yet, they can use this tool and still detect carious lesions. The dentist will also benefit by being able to see carious lesions in their early stages and determining whether action is needed or if they're able to wait. Here are my references regarding this topic. Thank you so much for your time.